So every year, Epilepsy Southwestern Ontario presents the HOPE Award, which stands for Helping Out People with Epilepsy, to an individual, a group, or an organization who has really shown great care and compassion for people with epilepsy and is committed to making a difference in the lives of people with epilepsy and their families. We're so proud to present the HOPE Award this year to the Comprehensive Epilepsy Clinic team. It's just a really amazing team, and they really care about the people that they work with. Congratulations, you deserve it.
The first thing I'd want people to know about our epilepsy program in Southwestern Ontario is just the strength and the pride we have in it. It's an innovative program that offers comprehensive care, holistic care that truly wraps around patients and families, delivered by an interprofessional team, and brings these skills that are focused not only on adult but also on children-specific education and skills together to offer this comprehensive program that's quite unique to our region.
We were able to materialize and assemble a team of excellent professionals that are passionate and provide care, have innovative ideas about research, are come together always with the same goal, to improve the life of people with epilepsy. I had the privilege to join forces with Dr. Miriam Nouri. She is the leader of the research epilepsy program, and I'm building on to make sure that London and London Health Science Centres and Children's Hospital is one of the leaders in pediatric epilepsy care, not only in Canada, but in North America and worldwide.
It really has been the pillar of bringing many health professionals together for the sole purpose of improving and providing better care to our patients with epilepsy. The reach and the impact is quite noticeable in our patient population. Affects across the age spectrum, and each different age you have unique needs that I think our epilepsy program has really been able to come together and address.
In the Comprehensive Epilepsy Clinic, we deal with individuals who have refractory or difficult to treat epilepsy or very early onset epilepsy, which has higher chances of being genetic. So we offer genetic testing to families to figure out if we can find a genetic reason, if there is one to be found. Because if we have a positive answer, it can have important effects, impact on management, how we treat the patient, and also how we give details about it to the family.
Yeah, so sometimes families talk about, just knowing or understanding what's causing epilepsy in the family can be helpful. But also information for other family members. So if genetic testing finds something, then we can offer testing to other family members as well to figure out if there's anyone else at risk of developing seizures.
I think for me, some of the most rewarding aspects are when we can go from a kid who has drug-resistant epilepsy and we have trialed multiple medications for them and they still continue to have seizures, and then we actually can, if they're good surgical candidates, can bring them through that whole entire process, and then the whole surgical process on the floor, going through that with the families. And I think one of our favorite days in clinics are when we get to see the kids post-op and they're not having seizures and their life has changed and they're so thankful. I think that's probably the most rewarding thing for me personally.
I agree. It's being able to work with some of the most amazing, resilient patients and families.
Yeah, definitely.
Hi, my name is Jasmine. I'm 19 years old and I was diagnosed with epilepsy when I was 8 years old. And my first very bad seizure was in elementary school. And a lot of people did not know what to do, which was extremely difficult. Ever since I've connected with CEC, they've been just extremely helpful with all different medications, all the research, all the support, and then just reaching out to see if I needed anything. When I was in the hospital getting my brain surgery, they celebrated my birthday with me, my 18th birthday, which was really fun. They wanted to make sure that I kept occupied, and just social workers and everybody coming in just to make sure I'm okay, all the nurses being so nice to me. I feel like I got to know them very well. It was just a really good experience, and I loved the hospital, which most people wouldn't say, but they were just extremely kind and just really supportive in just making the patient the priority.
During each transition clinic, I encountered the scary faces of patients and parents due to the unknown world of the adult epilepsy program. Direct communications with the pediatric team and their investigation set the terrain for me and the adult team to help provide the best care. My role in the transition CEC clinic is to facilitate the continued care for these young patients as they enter to the adult epilepsy world. Remember, we are here to fight epilepsy together.
Epilepsy might happen in one brain, but it happens to whole families too. I've never met a family that didn't have everybody impacted, whether that's by just the logistical impact of how do I help my child to access care? How do I attend all these appointments? How do I manage that with the other responsibilities? How are the other children in the family processing not just how epilepsy presents at home, which sometimes can feel really scary, but also the care that the child requires and the increased attention for that child. There's so many complications for families, and all of those things come with them to clinic, and that's why we have to have supports in place to not just treat epilepsy, but to treat the whole family condition.
We are the Carson family. My name is Chad.
My name is Josie.
Our son Chad was diagnosed with focal epilepsy in 2019, just days before his 5th birthday.
Dr. Andrade, Amanda, Dr. Dee Rupierre, and her team collaborated closely with us to develop personalized treatment that was best for Chad. They always went above and beyond to provide us comfort with their expertise and kindness to make the more difficult days more bearable. We appreciate the collaborative and supportive relationship with the comprehensive epilepsy team. They treat us with respect, empathy, and understanding. They always take their time to explain, listen to our concerns, and answer any questions. Amanda and Michelle are always quick to respond to emails or phone calls when needed. The team's dedication, professionalism, and commitment to their patients is commendable. The team's willingness to involve us in decision-making and care planning helped us build trust and gave us the confidence and reassurance to know we're making the best decisions for Chad.
As a decision coach, I bring the patients and the family's preferences and their treatment choices forward to the team so that we can come up with a preferred decision so they can move forward. I work together with them and the medical team to try to bring the understanding of the recommendation and give them the knowledge and information that they need to make a decision. It can be complex, and it's important that there is someone who understands the process, because it is a structured process that we bring forward to the families, bringing both the evidence and the patient's preferences together to get to a preferred decision.
And that's the whole purpose of the Comprehensive Epilepsy Clinic, is to take each family and what they need into consideration, and that's why we have so many resources that we're able to bring in.
And this is an amazing team who delivers epilepsy care, you know, within these walls of Children's Hospital, but even beyond into our community. And of course the Hope Award speaks to that, being on a journey with epilepsy for our patients and their families, their caregivers. This goes way beyond our walls.
Sometimes that means advocating for increased supports, both in schools or in the greater community. Sometimes that means connecting to counseling services as needed for not just kids, but also their siblings and families who are impacted by epilepsy. And sometimes that means providing that service on my own. We need organizations like Epilepsy Southwestern Ontario to help really pull the community together.
Yeah, and CEC is a great opportunity for ESWO to be involved and to meet families right where they're at.
Andrea has had the vision and has really worked tirelessly towards it, and not only championing locally the resources that we have, but also provincially, because it's been really, it's been quite the journey over the past 5 years for me here to see how far the program has come and how much we've evolved.
We have teams that are equipped with the right technology. Rosa, the robot that was provided by our foundation, really enables us to deliver exceptional care, and in some cases actually curative care. It's actually going to fuel the innovation and the research that we're going to do to create a better epilepsy care of the future. So I think the CEC brings everything together in one spot and allows us to reach the dream and the future that we want for our patients and our families.
There's lots of patients that we can help. and there's so much affecting these children and their families living with epilepsy. I can only imagine, and I have witnessed the fear of parents when they witness their child having their first seizure. It's really powerful and it's really concerning for them. So therefore, I think our passion about it and our goal to serve our community and make sure epilepsy is in the front stage of healthcare.
Just this week, we have made the transition from myself leading the neurology division to Dr. Andrea Andrade. It's a testament to her work in the epilepsy service and building the CEC that she's become so respected amongst our division in terms of her ability to be creative, to be innovative, to engage the community partners, and of course deliver excellent care. So much congratulations to her on that achievement.
I want to thank every single person in Epilepsy Southwestern Ontario. We are very humble to receive this award. I'm very grateful for all the support, all the care that ESWO provides in our community across all the region of Southwestern Ontario. Our community agency is one of a kind and definitely a model across community agencies in Canada. So thank you for the bottom of our hearts for this award. It means the world to us and to our team.
Yes, it is a privilege, really. Our patients, their story doesn't start here, really. This is part of it, and I know Epilepsy Southwestern Ontario really helps materialize and help families and patients overcome a lot of perhaps their unmet medical needs, and it really speaks to the multidisciplinary and holistic care that we like to provide to our patients. So we've always been extremely grateful for the partnership, and this is certainly a distinct privilege to receive this award.
I would love to say a huge congratulations to all those on the epilepsy team who run the comprehensive epilepsy clinic each day, who come ready to engage the families and care for those kids, to help make the experience a little less scary, make them feel like they've got that kind and careful care that they need.
The excellence that they show in all fields, they show excellence in everything that they've brought forward for epilepsy.
Congratulations to the CEC team for the 2024 Hope Award.
We are very proud to be part of the Comprehensive Epilepsy Clinic, and I look forward to doing more great things with them.
So a big thank you to everyone.
Great job, team. I'm proud to be a part of it.
Congratulations on receiving the Hope Award.
I just appreciate everything that CEC's done for me, and I don't know where I'd be without them. Thank you.